Group presentation presented by Group 3.11. Group member names are Larry, Kanwa, Sumiya, Aminai with our ID card number. Our focus is on AI chat board in NHS healthcare services. A brief introduction. This study explored the impact of AI chatbot on customer satisfaction and focused on the effect in addressing customer query, response time improvement, personalization, and overall user experience. These research findings indicate that AI chatbots significantly reduce waiting time, automate repetitive inquiries, and provide effective solutions for healthcare services. An AI chatbot in the NHS healthcare services is a smart digital device that uses artificial intelligence to interact with patients or users through text or voice. It can answer questions, give health tips, help book appointments, remind patients about medications, and even provide basic symptom check. The goal is to make NHS healthcare service more accessible, faster, and convenient. Background study. The background study. One, the NHS currently need to cope with the elevated patient demand, lengthy waiting time, and delay in appointment. Two, AI chatbot have begun to be used as a follow-up healthcare appointment scheduling and symptom integrated tools. However, this is insufficient evidence of their direct influence on hospital admission and quick access. The purpose of this study is to investigate how AI chatbot can improve the performance of NHS. Aims and objective. The aims is to explore how AI chatbot enhance access to NHS healthcare appointment and how they can assist in cutting down unnecessary hospital admission. While the objectives, one is to study how AI chatbots are currently used within NHS healthcare department. Two, to determine how AI chatbot help in triaging and appointment scheduling. Three, or four, to find how the correlation between chatbot and decrease in hospitalization.
So let's have the look on the literature review. So in the literature review, it highlights that like how the AI chatbot increases access to healthcare by automating appointment scheduling and triage, which was in Graslin ETL 2024. So by doing this, they can reduce the waiting time as well, and they do also have the like they do can automate the appointment scheduling, and they do also reduce the staff workload. The next comes to NHS 111 online and chatbot technologies enhance patient experience and lessen the strain on call centers. Like by doing this, they can reduce the pressures on the call centers by providing the instant guidance. The next comes to the avoiding preventable hospital admissions through early identifications with chatbots, which was in Sarah App case study I read in MedTech News 2025. So in this I came to know that especially like how the chatbots monitors helps identify symptoms early as well. They do provide the prevent the avoidable hospital admissions, especially for patients who do have the chronic diseases. Next comes to the accuracy and empathy are still issues for health like chatbots, particularly in complicated situations, which was in Alifity ETL 2025. On the next like it completely points out the issues with accuracy as well as empathy, and they do particularly have in the complex cases where the patients may prefer the human interactions. So I just point out the what the gap I found in that, and this was a literature review about that book. The next it comes to the chatbot evolutions. Like it was studied, I studied, but a little research regarding the influence on hospital admissions was discovered. Like I found a literature gap in this, how this like chatbot evolutions were studied, and they do found the last influence on the hospital admissions, which was in the Patham ETA 2025. So next it comes to the literature gap. So the literature gap which I identified was like the despite the literature supporting the uses for booking and trials, there was a little research on chatbots measurable on hospital admissions rates and appointments punctuality within the NHS. This study uses a practical outcome focused methodology to close the gap. Like I found the literature gap in which I found that they can be the issue of the timing as well as for the appointment scheduling. So as we have used the other methodologies to focus on this gap, and we collected the data from the surveys, from the questionnaires, and from the other like sources which we used in this. So this was all the gap which I identified, and this was the literature review.
My name is Kamal. In this section, I will present the research philosophy. For our study, we have chosen pragmatism as our guiding research philosophy. Pragmatism aligns best with our research question, which is rooted in real world incidents. So basically, we decided this research question because of someone I personally know. So basically, this individual was unable to secure a timely medical appointment, which tragically led to a series of escalating health issues, both internal and external, and ultimately resulted in a 3 month of hospitalization. This case highlights the practical and urgent nature of our inquiry, making pragmatism as an appropriate philosophical stance. It allows us to focus on real life consequences and actionable solutions rather than abstract theories. So let's discuss our research approach. So this study uses an abductive approach. Basically, we started a real life case of delayed NHS care that led to a long hospital stay and multiple health problems. So basically, we are trying to find the most likely explanation by looking at patterns in what patient and staff have experienced, along with what the research and data says. This approach fits well with our pragmatic philosophy as it focuses on solving real problems. It also supports mixed method, helping us to explore how AI chatbots could make it easier for people to get NHS appointments on time and reduce unnecessary hospital admissions. Let's move to our next slide. The next part is research design with a reference of Research Onion. So our research design is structured using the Research Onion framework, and our chosen philosophy is pragmatism, which allows us to focus on practical outcome and use method that best addresses our research question. Our reasoning is abductive reasoning, which means we are moving between theory and data to develop a reasonable explanation, and it is especially useful in exploratory contexts like ours. And for our strategy, we are using survey-based approaches that enables us to collect data from a broad sample, which helps to understand patterns across the population. For method, we have selected mixed method, combining qualitative and quantitative techniques to enrich our analysis and provide a more comprehensive understanding. For study, we choose cross-sectional, capturing data at a single point in time, which suits our aim. And for techniques, we will be using structured questionnaire, ensuring consistency in data collection and facilitating statistical analysis. The rest part of the presentation will be presented by my friend. Thank you very much.
My name is Minahil, and the part I'm going to present is research methods, like what sort of methods we used in our research study of NHS health appointments. So the basic one is the philosophy, how what research philosophy we adopted. We use pragmatism because it concentrates on real world health problems that have a practical outcome, that have a practical solution. So for example, like in our case, NHS appointment delays is a real world problem because we are facing these issues daily. So after this research we can synthesize a solution for this problem. And the research approach we have adopted is mixed methods. We used both qualitative and the quantitative methods because we required both the numerical data of the number of hospital visits and the number of appointment delays and appointment missed, along with the user experience, the patient experience, like what sort of experience they faced while they were carrying out their appointments. And the research strategy we applied, we also use case studies that has already been done for NHS chatbots and the patient surveys, and the interviews were also conducted with NHS employees to record their experience. And the time horizon we used was a cross sectional because at one time, at the same time, all the data was collected. The next we have data collection methods, like what sort of data collection tools we used. The major tool we used was the online structured questionnaire. It was a closed-ended questionnaire which had number of sections. For example, the demographics were there, the gender, age was there, and then chatbot usage, like how frequently they are using chatbots for their appointment settling, and how weekly or twicely or how in a month. And access to appointments, like how many times they were able to access the appointments and how many times they missed the appointments and they were delayed appointments. And hospital admissions, like their frequency of hospitalization, like in a week or month, or how many times they have been hospitalized. And we use the convenient sampling techniques via NHS forums and online platforms where we uploaded the questionnaires so the data can be um, collected on a large quantity, and it can also be closed, like there should be no biasness in the data, and it also preserves the ethical and ethicity and the privacy of the participants. And then I can justify this by the correspondence with pragmatism, like how pragmatism corresponds the mm, method we used because it is used to solve real world problems so that have a practical outcome. And mixed methods allowed us to have a large quantity of data and sets there so that we can validate and compare the data from or both the sources. And it can also be useful in the areas where we have to collect a large number of samples. For example, in healthcare departments where the experience, user experience, patient experience is also valued along with the numerical data. So this method also addresses the gap that we have found in our study, the already existing literature. So this was how we use these methods in our data collection and research methodology topics of NHS appointments. Um, and these are the references. We have also added all the references of our literature, like from where we got our literature and literature gap, and along with that methodology and research methods and data collection tools. These are all the references for them. Thank you.